right, we have quite a treat for you this morning. With these colder temperatures, we have a doctor in-house to tell us how to winterize your skin. Dr. Rocco Piazza is with us. Good morning.
Good morning.
All right, so what do we need to do to make sure we don't get that dry, flaky skin when it gets cold?
Okay, so what we've seen, obviously, over the last 24 hours is really a cold, dry air mass moving to central Texas, and so that humidity that we're normally used to is gone.
Yeah.
So everybody's going to start to notice that maybe their skin's feeling a little bit dry, especially kind of in the mid-face area around the eyes, maybe even a little flaky, some inflamed redness going on, and that's not uncommon when this happens. So I think the keys are really making sure that you're using a gentle cleanser, something that doesn't strip the skin of its natural oil properties, as well as a moisturizer. And lotion moisturizers may not work anymore. It may be time to switch to more of an oil-based moisturizer.
And how do you know when it's time to do that?
Well, I think you have to really, you know your skin better than anybody else.
Yeah.
I mean, you're the one who takes care of your skin every day. So you've got to be able to kind of gauge that feedback and notice as things are changing with your skin.
All right. Well, and you're a doctor, so you have special products that you brought with you. So what are these and how do they work?
As a plastic surgeon, I obviously believe in prescription-grade skincare, and that doesn't mean expensive skincare. It means affordable skincare, but we want to see results, we want to see changes, and we want to make sure that you're not having any of these symptoms I've described. So this line is a very gentle line. This is Theraderm, and it comes with a cleanser. It really doesn't strip the skin of any of its oil properties. And then it comes with a fruit acid exfoliant, which is something like lactic acid. And lactic acid is normally produced by the body. It's a gentle chemical exfoliant versus something like an apricot scrub or something like that that may abrade the skin. And then an OPC repair gel. And this, I want you to try this. Let me see your hand.
Okay.
This is an antioxidant serum. And it is really nice because it has things in it like green tea and other things that really help to give the skin back what it needs, but yet it doesn't leave the skin feeling oily. It rubs in, and it really helps well, especially in these winter months.
Very silky.
It feels good.
Yeah, it does.
And then a cleanser, then a gentle cleanser. And these work to really hydrate the skin. So some great things that can be used that can especially get you through these winter months and even work well in the summer.
All right. Now, I know this stuff probably does miracle stuff, but like I was telling you, I like to buy, a $5 tub of vitamin E lotion. I put that on my face at night and works. So what products would you recommend for people who, just go to Walgreens or their grocery store to buy things? What kind of things should they be looking for? Absolutely.
I think that Cetaphil is a nice product. It tends to work well. I know that it tends to be very gentle and works on multiple different skin types and make a nice cream for especially in the winter time. That would be one of the things that I would consider using for sure. Especially for other parts of the body, legs, hands, feet, tends to work very well for those areas. Cleansers vary, and I think that individuals need to make sure that whatever cleanser they're using doesn't leave their skin feeling dry, because your cleanser shouldn't leave your skin feeling dry.
I think that's a really good point, because there are so many, you go to the store and it's just like, wow, what do you pick?
Right.
And so are there certain things that you should look for that, I shouldn't have this in this?
Well, I think the things that really have, we've shown that really work well are things that have antioxidants. So cucumber, green tea, all those things that have some natural type extracts in them tend to work very well. They're natural antioxidants. They really prevent further skin damage, and they can help to hydrate the skin, especially in the winter months.
That's really interesting, because you never know if it's just like a marketing ploy to get you to buy it or not, but that's very interesting to know. And where is this available, by the way? This
is available in my office. I think there's a couple of locations in town as well. This is only sold through physicians' offices, but again, it is affordable. It lasts you 3-4 months. Products are always meant to, use less is more. So theoretically, you want this to last a long time.
Well, let's face it, winter's only 3 months here anyway. So
there you go.
Thank you very much for coming in. We certainly appreciate it.
You're welcome.